Hi, everyone, and welcome to our talk about excess sweating. It's based on an article by Dr. Jockers of his excess sweating, the causes of hyperhidrosis and natural strategies from August 17th of 2021. If you have any questions, please feel free to give Dr. Justine a quick text. I'm sure she would be happy to answer all of your questions. Today we have Dr. Justine and Dr. Udani here. Dr. Justine being our leader here at Justine Blaney Wellness Center, and she's a very passionate, a motivational speaker. She speaks in the community, at universities, local businesses, and charities. But her objective is to provide the best care and for you to be the best version of yourself. And Dr. Udani is our naturopathic doctor here at Justine Blaney Wellness Center. And she is very passionate and loves to work with individuals from all backgrounds. And she genuinely believes that everyone has the ability to make healthy, long-lasting changes. Please help me welcome Dr. Justine and Dr. Udani.
Hello, everybody. We got great information with you. Sweating can be so embarrassing, especially if it's just way too much. And yet sweating can be so healthy. So we're going to have a great talk with you. Coming up, we have one about memory, brain fit, how to help your brain function better. We have different stretches with before and after sports with Michael, who used to work with us and is now at Chiropractic College. We have our golf stretches. And finally, we have a series on help with mental stress, with how to create thicker skin when someone says something that rubs you the wrong way, how to be just mentally tough. So we're always trying to provide new topics in order to be able to help you best.
Those talks sound amazing. And today we have one that is equally amazing. I think something that could be very embarrassing for a lot of us. Excessive sweating, it can, especially now the summer is coming up. And if you're dealing with this condition called hyperhidrosis, this is a talk for you to figure out how can we manage this naturally. So what is hyperhidrosis? So really basic terms, it means you're sweating a lot. So this is you sweating way too much excessively. And those people that you might notice that they have a lot of big armpit stains, or the back is really drenched. That's like too much sweating before their setting. So even if it's just not even that warm, they tend to sweat. Or if you're nervous, you tend to sweat. This is a term to describe all of that. And that can be very tough on your mental health, and it could be embarrassing. It doesn't matter if you're a man or a lady. It just can be one of those conditions. So we're gonna dive deep into what is sweating, what is too much sweating, and all of that. So what do you need to know about sweat? Because like Dr. Justine mentioned, sweating can actually be very, very good. Something that I actually recommend to my patients all the time, because sweating helps eliminate a lot of toxins. It can actually help with skin. It can help heal wounds. It helps your kidneys. Deal with excess salt. And in our day and age, we eat a lot more salt than we should for most of us. And it can also make us happy because when we're sweating, we tend to had just maybe gone on a run or exercise. But when it can be too much is when the sweating, we just don't know why it's happening. It can be coming uncontrollably, and it just becomes more of an embarrassing condition. So what are some symptoms and signs of this too much sweating? So yes, of course, you can have visible sweating. So I actually have a story for you here. One of my colleagues, every time he eats something spicy, you can see the sweat coming in his scalp. And for us, it's a little bit funny, but we don't really know. It might be embarrassing for our friend, even though he plays it off. But there could be visible sweating that you notice, and you can maybe see dampness and sweat marks on clothes, like I mentioned. You can have like smelly athlete's foot, other skin infections. And sweating can also interfere with your daily tasks. So things like where you're trying to do your work, but then you're sweating too much or too hot. You can also have your skin peeling or pale skin, anxiety about sweating, especially let's say you're at a job interview or you're on a date, right? And you start to sweat a lot. That could be very, very embarrassing as well. And night sweats while sleeping. So this can be something that a lot of us women can experience, hot flashes, too much of that can be a sign of excessive sweating too. So these are some of the different ways that are different types of this excessive sweating. So you can have sweating just on your head and your face where you're drenched in your hair is sticking to your face. You can have it under the arms, have your hands very clammy. Like when I'm nervous, my hands start to get very, very clammy, very wet, and it just annoys me because it's like so sticky. You could have sweating in your groin. You could do too much sweating in your feet. So then at the end of the day, your feet are smelling really bad. Or the whole body can have excessive sweating happening too, where your back is drenched, all the clothing, you notice that it's really, really, you see the stains. So what are some risk factors? Because this is, in my opinion, I don't really think we know too much about how to about this condition. A lot of even medical doctors, they sometimes don't really know the root cause of it. So there could be a lot of risk factors for excessive sweating. And this is where, I usually do a 1 hour intake where we go through everything to really get to know you, to figure out what is the root of if you have this issue. Right. So this can range from, we're trying to see, is there any blood sugar issues? Is there trouble with losing weight? Are you dealing with maybe some infections that you're not aware of, like low-grade infections? There could be even things like mercury poisoning, for example. Certain tumors and cancers can cause excessive sweating. Certain foods can cause it, like chocolate, hot sauce, spicy food. And of course, sometimes even certain supplements and certain medications can cause excessive sweating too. And alcohol, if you notice the night after or the day after you drink alcohol, you might notice that you tend to sweat a little bit more. So these are all factors that can explain what's going on, but it's important that we figure out exactly what it is going on for you with a thorough intake. So that's why, I loved figuring out the functional root cause of excessive sweating. So a lot of times this can be things like trouble with controlling your blood sugar, can be things like low vitamin D. A lot of us are low in vitamin D, so it's good to get it tested to figure out what's going on there. You can have B12 deficiency too. Menopause is a big thing as well. I'm sure one of the first symptoms that a lot of my patients tell me is that I have too much sweating. I'm too hot all the time. So that could be a sign of menopause too. Heavy metal toxicity, like mercury, for example, when your body has too much of that, it tends to sometimes try to sweat it out. Food sensitivities, intolerances to dairy, gluten, even eggs, and certain Chinese medicines can also trigger sweating as a result of the medicine, because it's trying to detox your body. And of course, too much heat can be functional root factors. So let's talk about some of these. So first root cause is insulin resistance. So what are some signs? What is insulin actually? So insulin is a hormone that help our body regulate blood sugar. So every time we eat something high in sugar, we get a huge dose of insulin released from our pancreas. And when there is too much of this happening all the time, our body tends to become a little bit insensitive to insulin. It's like it resists it. So some signs of that is, we tend to be more overweight or have trouble losing weight. This is a big one for a lot of us. Might be craving sweets after a meal, or having a big appetite, or you feel more tired after a meal, like you feel like you want to take a nap after a meal. You might have hormonal problems like PCOS. You can have excess hair growth or acne, high blood pressure, high cholesterol. These are all signs of insulin resistance that I would do testing for. And also there's a lot of different natural ways that we can manage this. Root cause number 2 is menopause, everyone's favorite thing, especially for us ladies, something to look forward to. But, this is something that is, of course, we all have to go through. It's part of life as women. But one of the common causes of perimenopause is you get that flushing, you feel the heat, especially on your neck and your chest. And, that affects your sleep. You might have trouble sleeping. You might feel more fatigued. And other signs of perimenopause is things like changing your mood changes, where you feel irritable, changing your periods. You can have hair loss, dry skin, low libido, weight gain. So there could be a lot of different things. And I know from my mother, when she was going through menopause, it was for her depression. She was going through mood changes. So everyone can be different, but she also experienced hot flashes as well. And let's talk about vitamin D deficiency. So I know, during COVID, I know for myself, I was recommending quite a bit of vitamin D because a lot of my patients were coming up low for vitamin D. So what happens when you're deficient in vitamin D is it's not just for your bones, it's not just for your immune system. Vitamin D works on every part of the body, and including your blood vessels, including your nerves. So when it comes to sweating, there is, maybe overactive nerves that causes the sweating to form. So that could be a result of vitamin D deficiency. So I always say, don't guess, let's test. Let's figure out where your levels are to make sure that we give you the right supplements, or we help you with food or spending more time outside to get your levels up.
I definitely agree. And I just want to let everybody know that even if you think you're taking a supplement, first make sure that your body's absorbing it. So test, don't guess. Talk to Dr. Udani or even your medical doctor. Get your vitamin D levels tested to see if you're absorbing and you're getting enough. And I know, as a sort of very pale-skinned person who works inside, I need a lot more vitamin D than the average person in order to maintain those higher levels of vitamin D that are so crucially important for our health. So certainly, definitely get tested on a regular basis. This isn't something you do on one time. This is something we test regularly. And if you're low, then every 3 months you can get tested to see if you're getting enough supplementation.
Absolutely. And another big vitamin deficiency could be vitamin B12. So a lot of times when we experience fatigue or that brain fog where we feel like there's a veil in front of our eyes, trouble with focus, or we're losing hair, or chronic pain where like there's aches and pains or tingling in our arms and legs, there might be a B12 deficiency going on here. And we can easily figure this out through blood tests, blood work, to see if we need to, give you more B12. And B12 is one of those vitamins that is only found in animal products. So if you tend to be a vegetarian, you might be more at risk of low B12. So we test for sure. And then there's ways that we can increase the supplement, add supplements to help with your B12.
What would be some of those symptoms or someone could have if they were low B12, Dr. Udani?
Right. So with low B12, I would say one of the big ones, Dr. Justine, is tiredness. So trouble with focusing and just too much tiredness for sure. And sometimes you might notice hair, nail changes too with the B12. So let's go to number 5, root cause, which is heavy metal toxicity. So we have a talk coming up on toxins that I would think you should really tune into, and this is all about our toxic burden. So I like to think of it as a bucket. So our health and a state of our health is dependent on this bucket. So we can dump in stress, lack of sleep, medications, unhealthy diet, and all of these things, and it piles more and more and higher. And over time, what happens is this bucket gets almost full. And heavy metals can add to this too, and it overflows. So when it overflows is when we get those symptoms like fatigue, headaches, joint pain, digestive issues, sleep trouble, and bigger things like diabetes, high blood pressure, all of that. So heavy metals can really add to this too. And you can be exposed to this in everyday things that we have in our homes. So making sure that we reduce our heavy metal toxicity is very important for helping with chronic sweating as well. And the root cause number 6 is making sure that we're not eating foods that our body is sensitive to, or we're figuring out what kind of sensitivities or foods our bodies have for certain foods. And so a difference between a sensitivity to an allergy, because you might be wondering what's the difference, is that allergies usually happen in childhood, and it could be immediate, so for example, if you have a nut allergy, if you're exposed to it, you're going to get the reaction right away. But with sensitivities, it can happen over time. So you might feel bloated, you might get more joint pains and aches, you might feel more tired or get headaches. But these are signs that it could be a sensitivity to some of the foods you eat. And what all this does is increase inflammation, and this can make sweating worse. This can make a lot of other issues in the body worse too.
Dr. Udani, I'm somebody who suffered from so many food sensitivities and allergies. Just right from the day I was born, they said I was allergic to my mother's milk. I was covered in a rash in the color of a tomato. And I don't think I was actually allergic to her. I was allergic to what she was actually eating that was coming through the breast milk, because a lot of those products do come through the breast milk. And it's one of my passions is breastfeeding. But certain things like a wheat, for example, you might be fine, but you get achy joints or you get really fatigued levels. So sometimes these symptoms are kind of vague, and we don't realize it. It's not an immediate, I can't breathe, or an immediate, like if I eat food colorings, I'll get immediate rash, like all over my chest. If I eat gluten, I get a rash all over my stomach. But it's not like necessarily like a painful, aching stomach, immediate upset stomach. So these food sensitivities, they can also add up. You can eat it a few times and be fine, but then you eat it, 5 times in a week, and then you have a problem. So it's hard to manage, and definitely something to see the naturopath, do a food diary to monitor with your symptoms along the way. And then I have done some different techniques called SKIO or biofeedback to really lower those reactions, to reduce those intolerances, reduce those allergies, and it makes it a lot easier to cope with them in a natural way versus all sorts of just popping Sinutab, chlortriptyline, or different allergy pills. Literally, they do stop working, and they do create often a rebound effect. So be very cautious that that's a slippery slope, and do want to look at ways to manage these food sensitivities, allergies better with the naturopath, with the biofeedback, the SKIO techniques out there, and we can help you with those referrals.
Absolutely. Thank you, Dr. Justine. And I would like to add that, it's becoming more and more common, and even in younger and younger children too, that these food sensitivities. So it's definitely important to figure out what foods that you might be sensitive to, and come up with a plan to heal your gut, anything like that. So this is actually based on traditional Chinese medicine, the 8 principles. And I do acupuncture at the clinic. I love doing acupuncture for so many different concerns, like joint pain, to stress, to sleep, to fertility. And it's really based on the principles of yin and yang. So you might have noticed that yin and yang pattern, the black and the white circle with the white in the middle and the black in the middle of the white. And so it's all about balance, right? So how do we have a balanced body? And through Chinese medicine, there's different signs that show that there's an imbalance. So for example, if you look at the yang side, it tends to be more fire. Yin side tends to be more water. So, yang side, if you have excess of that, you can get heat, too much heat in the body that we need to eliminate. And, there could be sweating can be one of those results. So with acupuncture can very much help with excessive sweating, can help you feel relaxed. I love it when my patients actually fall asleep while they do the acupuncture. I can hear them snoring. So I feel like that's good. I did my job because it can be very relaxing, especially in our stressful days, to get some acupuncture done too. And also these points are so powerful because they can help really treat so many different concerns. And so let's talk a little bit about some conventional treatments for excessive sweating. So things like, you can use antiperspirant or deodorant, but you want to be careful because a lot of deodorants these days contain aluminum, and that is a heavy metal, and it's right and you're putting it right in the armpits, close to your breasts. That's a very sensitive area. So got to make sure you look out for clean antiperspirants, aluminum-free. There's prescription medications that it can help too, but over time these tend to not work as well. That's the problem with our body gets used to it. There's you can do ionophoresis, which is a procedure. You can even use Botox to numb the nerve that can cause the sweating. But you're introducing a toxin that can over time also not end up working or can cause more damage than you can imagine. There's surgical options you can do. There's electromagnetic energy treatments that are also options for excessive sweating. But I always say, let's figure out the root cause of what's going on. Let's try to get it there instead of putting on a Band-Aid solution.
I completely agree. And that's why we're going to cover 13 support strategies. Unfortunately, my phone's going crazy. Give me 1 second.
Well, I can talk a little bit about the support strategies.
I'm right there. We got the strategies. So we're going to talk about the anti-inflammatory diet. We're going to talk about food sensitivities, how to get more cooling foods, hydration. As Dr. Udani talked about, the acupuncture, improving our sleep, our vitamin D, B12 levels, improving our detox systems, using baking soda and lemon, different types of teas, black cohosh, and how to do dry brushing. So we've got 13 techniques coming your way to deal with natural support for this excessive sweating and just helping our body, even if you are sweating, but it's more of a toxic smell and you're not happy with that. This is some of the techniques for you, or for gently recommending maybe a loved one. So number one, anti-inflammatory nutrition plan. The toxins that we eat come out through our sweat. So the toxins are definitely these processed foods that come in a can, a box, a bag, the pops, the sodas, the processed meats, definitely things like fried foods, foods that you're basically going to get on the go are usually pretty severe for you. If you're going to eat on the fly, I try to think of something like a natural burrito bowl. So without the without the wrap, you're getting it all naked, as they call it, naked burrito bowl. So you're getting lots of vegetables. But the majority of the time, if you're going for fast food, whether it's a hamburger or a hot dog, quick meat, it's often really, really poor for you. So we want to aim for improving our diet. We have wellness talks on the anti-inflammatory diet, specifically a whole half an hour, 45 minutes. Check those out. And also you can do a consultation with our naturopath to really look at an anti-inflammatory nutrition plan designed for you. Number two is eliminate those food sensitivities. And that's often doing an elimination diet. So for example, if you're not sure about dairy, eliminate dairy for 2 weeks and then have a day full of dairy and see how your body reacts. Or do 2 weeks of no gluten, no bread products, and then have a day where you have as many bread products as you can manage and see how your body reacts. There's tons of other areas with soy, and that can be hidden in many foods. The biggest one is sugar. We are addicted society to sugar. So even if you just take a weekend off of no sugar products, that's very cautious, because sugar is put into bread, buns, crackers, yogurts. It's hidden in so many areas, and really try and have just 2 or 3 days of only natural sugars from fruit, no other sources of sugar. you might get a headache. You might really have a withdrawal symptoms from some of these sensitivities, but that actually just gives you a sign that your body is in a state that is not healthy anymore. And these detox elimination diets can affect excessive sweating. Is your body trying to get the chemicals out? And it's important to do that under a guided way with the natural path.
Another support strategy is eating more cooling foods. So a lot of times, in the summer, you might add cucumbers, you might add some berries to your water, because you can notice some foods tend to be can cause heat, and some can be more cooling. And a lot of processed foods, like Dr. Justine mentioned, not only are they very inflammatory, they can cause sensitivities, but they can be really can cause your body to feel more hot. They can have to heat, like imagine things like pepperoni or prosciutto, they can cause your body to have more heat in them. So I always say veggies, berries and fruits, things like that tend to be more on the colder side. They tend to kind of calm the body more. And this is a great list that can show you. And I always say, when in doubt, go for cucumber. It's always so good. Add it to your water. Great source of water in itself too, and minerals too. This is another great support strategy of, making sure, even though you're sweating, you might think, oh, maybe I shouldn't be drinking as much water, but actually you should drink water to make sure that you are not getting dehydrated. And also it's important to, especially if your sweat has a smell, to help dilute that by adding more water into your body to flush it out even more. And, a good hydration could be, you can add different vegetables like cucumbers, berries into your water to help it taste good. You can add some lemon into your water to make it like a nice cleanse first thing in the morning. And you can also add things like Himalayan salt into it to make sure that, when you're sweating, we're releasing a lot of our electrolytes or minerals. So we want to make sure we're putting them back in the body too. So, and another great thing is I don't necessarily drink a lot of the tap water. I like to boil it, and I have a filter. That way, you're getting you're making sure that all the bacteria, everything is completely killed, and you're getting a good, healthy water as well. So this is another
one is improving our sleep, which is crucial. So a cooler environment for your sleep, a bedtime routine, getting your clothes ready for the next day. No electronic products right before bed, because that stimulates you. So even if you're used to an e-reader, that's light. You're best to look towards a real book right before bed. Time for prayer, meditation before bed. Trying to get our exercise daily, because that improves our sleep, but not right before you go to bed. And looking at the light sources in your room. I know one of the things we have in our bedrooms is those blackout blinds. They can make a huge difference. But I would say the number one thing is that routine. The hours before midnight are what count. So if you're doing the 12 p.m. to 7 a.m., it's not the same as a 10 to 5. All right. So we really want to look at that routine, trying to get yourself to bed before midnight and a similar time every single night.
I would also like to add, cutting down caffeine, at least 6 hours before you go to bed, because that can stay in your body for that long time. So going decaf or making sure you have coffee way earlier than, that really helps too. So acupuncture, amazing strategy for so many different things, but also for sweating. And the way it works is, it can stimulate powerful pain-killing molecules from the brain. It can make you feel really relaxed. I know you might think needles and relaxation doesn't really sound like it's good, but the needles are actually very, very small. They're very thin. A lot of times people don't even notice that, you're getting a needle in you, and it can really help you feel relaxed. And it can it can change your response to pain too. So and there's so many different points and when I do it, I always make sure that you're comfortable and that you're not in pain, and that we have that communication going on to make sure that you are at your most relaxed state as well. And, like we mentioned, we got to make sure, we got to test your vitamin D and vitamin B12 levels to see if they are optimal. Because if they're not, there is so many different signs of the vitamin D deficiency, vitamin B12 deficiency. So let's test. We want to make sure that you're in that optimal level, because even if you're in the normal range, you might be too low. So we want to make sure you're in a nice optimal range so that you have a good amount of vitamin D, good amount of vitamin B12 to keep you going. And another great support strategy is let's open up your detox pathway. So one of the reasons you might be sweating too much, it could be that your body is trying to push the toxins through sweating because the liver, the kidneys, your digestive system is not working optimally. So this is where I love to give lots of support for your promoting your liver, which is our biggest detox organ. Support with your gut, especially if you're constipated. We want to make sure you're more regular. So what is constipation? Because sometimes the patients come see me and I ask them, how often do you go to the washroom? And they'll say, oh, I go once every other day. I'm like, that's not really optimal. We want to make sure we go at least once a day because, we want to make sure we have clean pipes. We remove everything that we ate. So supporting this is something I'm so passionate about. And once we promote these pathways, you might notice the sweating actually tends to go down too. Then also another big thing is, especially if your sweat is more on the smellier side, that could be a sign that there's some trouble with these detox pathways. And while we're doing these detoxes, there's so many different minerals and products that can help bind to these heavy metals and chemicals and also break them down in a safe and natural way to get them out of your body. So what is important here is, like Dr. Justine mentioned, when we start something like this on your own, it can be stressful on the body. So you want to make sure we have step-by-step process and also someone to guide you through all of this. And you might not even need to take all of these for it to be effective. One of the best deodorants that I do love is baking soda and lemon, and it's just natural, simple ingredients. And you can make a little paste with about half a teaspoon of baking soda with an ounce of lemon juice. Try to have a fresh lemon juice and not the ones that come in the the lemon shaped container. Fresh is always good, and you want to let it fizz and settle into a paste. And when you apply it, baking soda, this recipe really helps kill any bacteria that's making the sweat smelly. And it can actually also help lighten underarms and kind of exfoliate the skin too. And this is another great tea. I love chamomile tea. It's so good for your digestion. Very nice, very calming right before bedtime to take as well. Witch hazel is another great, we call it clears out your skin, your body. So what we can do is you can actually soak a cotton ball in this tea and you can apply it in the spots that you've noticed excessive sweating, and that can help kind of calm down and tighten the pores so that you're not sweating as much. So a great thing to do. But here's the thing, right? With all of these strategies, you want to feel consistent. When you're consistent and you do it, that's when you start to notice it really being helpful. Another great one is these herbs, black cohosh and schizandra. So these herbs, including chamomile, witch hazel, sage, they really help balance the hormones that could be causing excessive sweating. So let's say you're perimenopausal. These two might be something that I might prescribe to you, but that's why I want to make sure that these are powerful herbs. So you don't necessarily want to try them out just buy it off the natural health store, because sometimes it might be too much of a dose for you. So we want to make sure we balance it out based on your picture, your individual picture. But these are great herbs to use that can help with hot flashes. And this is something I love, because dry brushing is so calming. It's so soothing. You can do it just before you go to the shower. You just need a pedal brush like this. You just do gentle circles all through the body. And this can really help with improving your blood flow, helps with improving your lymphatic flow. And lymphatic is a great detox part of the body too, and that helps with detoxing. So it can help with sweating in that sense. So another great way to relax your body as well.
Awesome. I definitely have referred many people to dry brushing. Not only to improve your skin, that's the one area of many that it can improve, because it improves that whole circulatory area. So helping your nervous system, helping your vascular system, helping your lymphatic system. And so inexpensive. You can get these brushes literally for between $10 and $20, and you get the long handles, so it's easy to reach. Now, as a chiropractor, you want to look at all of those 13 areas to help with excessive stress, sweating, because that is a stress on your body. It is a symptom that your body's telling you that there's a problem with these detox pathways. And chiropractors work with the spine and the nervous system to reduce that fight or flight response. And we know when we're under stress, we get anxious and we get tense and we sweat more. So chiropractors help remove those areas of subluxation. We're experts at finding, detecting, and removal of subluxations, so that your brain and body can connect better. Your body can send messages to that liver and your kidneys to help you detox better. But it does require a team approach. It does require effort. Excessive sweating that's, average, but with a different smell that you're not happy with, is something that you can get help for. So we're here to help you. We have a great team. I am also an acupuncture patient. It does not hurt. It's so comfortable, so relaxing. Many times I do fall asleep. I'm one of those where you all of a sudden you do a little shake because you didn't realize you fell asleep. It is that relaxing. So definitely recommend coming to our center. We do offer complimentary checkups. Much of this information does come from Dr. Jocker, so we want to give a shout out to him. And these complimentary consultations or meet and greets are 5-10 minutes to ask questions to make sure you feel you're in the right place. Our goal is to make sure you're truly comfortable. We have so many of these amazing talks here to help you. Upcoming, when we have ones about stress, about stretching, about how to be mentally strong. So stay with us, connect with us. We have ongoing information every single week because we care about you. These are free. You can share these with friends and family. We care about you, and we want to cover other topics. So we have a new topic every single week. And if you learn one new thing every single week, or even just apply one thing that's different every single week, imagine where you can be at the end of the year, at the end of several years. You're a new you. And our goal is to be part of that process. So stay connected with us. We love and appreciate you, and we look forward to being again with you soon.
Thank you so much for tuning in, everybody. Have a great evening.